Hey everybody, this is Dr. Jones, DC with Colorado Medical Solutions. And if you're watching this webinar, then today you're here to learn about HIIT training or high intensity interval training. Now, this is one of my personal favorite style of workouts because it's the most time effective and it's the most powerful. And I know you're probably thinking, well, what does that mean? It's the most powerful. It has the most benefit, the most bang for its buck out of all the styles of working out. And I know the number one complaint we hear from people is I just don't have time to work out. And the response to that is, that's just an excuse. You can make time. And while I do believe you can make time for anything that's so important, the reality is it's going to be easier to make time if it's less time that you need to make. And that's what HIIT training is all about. And the research is continuing to pour in on just how effective this working out is. So let's just kind of dive right in, folks. As always, consult with your physician before starting a new exercise regimen, especially something more intense like HIIT training. So I'm going to bore you a little bit for no more than a couple minutes here with some facts. But what I'm attempting to do by sharing these facts with you is kind of open your eyes to the dilemma of what's going on, not just America, but really across the board here with our world. But we'll talk about America. So the U.S. Department of Health and Human Services, only 1 in 3 children are physically active every day. Just one. Less than 5% of adults participate in 30 minutes of physical activity each day. Only 1 in 3 adults receive the recommended amount of physical activity each week. Now, 5% is horrible, but 30 minutes every single day, that's a lot. That's hard. And I don't expect most people to get that much time, to have that much time to be able to work out. But the fact that it's less than 5% is kind of mind-boggling when you think about it. Only 35 to 44% of adults 75 years or older are physically active, and 28 to 34% of adults ages 65 to 74 are physically active. More than 80% of adults do not meet the guidelines for both aerobic and muscle strengthening activities. And more than 80% of adolescents do not meet enough aerobic physical activity to meet the guidelines for youth. So again, this is this is powerful. This is from most recent stats here, 2017. I would have guessed they were bad. I knew they were bad, and I wouldn't have guessed this bad though. So it's a problem, right? Because we're all aware that America is the most obese country. It's on its way to becoming the most obese country in the world. We certainly spend more on healthcare than pretty much the majority of the other top countries in the world, and yet we have this amazing therapy that is virtually free, and we just don't use it. We're not participating in enough exercise, and I don't know why. Maybe there isn't one of the reasons I think is there's a lack of awareness. There's a lack of education, because I don't think our standard primary care physicians are pushing exercise as much as they should because of how powerful it is. And we know why. There's no money. They don't make money, the pharmaceutical companies, when they're prescribing exercise, so it doesn't happen. The benefits. Well, the obvious is it's going to help you lose weight. Calories in versus calories out. In order to successfully lose weight, you need to consume less calories than you burn. You need to burn more calories than you consume. Now, it does become much more complex, but that is the crux, the base of weight loss. And the research shows that caloric deficit, if you create that from burning more than you do from just eating less, your weight loss is going to be more successful, reducing the risk of heart disease. Your heart is a muscle, and it gets stronger just like the rest of your muscles do when you work those out. And so heart disease does decrease. Also, heart disease comes from the plaque buildup in your arteries, and that's an inflammatory process. And we know that inflammation is going to decrease when you work out, when you exercise. Working out is going to help manage your blood sugar levels. Now, you might have been told by our staff that you have metabolic syndrome. Metabolic syndrome, while not necessarily recognized as a medical condition, it is a medical disease. It is a condition, and essentially what I call it is pre-diabetes, and HIIT training is extremely powerful for that. Now, it helps maintain lower blood sugar levels because you're burning the sugars, and so when you burn the sugars, you're going to have less for your body to have, and so it kind of common sense why that's going to be beneficial. It improves mental health and mood. Less anxious swings, less depressive moods, and just overall stabilization. There's a lot of endorphins that are released, as you probably know from working out, and that's going to be what helps contribute to the better mental state. It helps maintain cognition as you age. So some of our patients watching this video are older, and they've noticed they don't remember as well, they don't think as clearly, and while there's many reasons to that, usually stemming to inflammation, working out has been shown to offset that because of the chemicals that are produced that have positive impacts on literally producing more neurons and starving off, sort of slowing down that destruction of neurons in the brain. BDNF is actually one of them. It's going to reduce the risk of some cancers, and it's actually going to improve your sleep. And honestly, I can give a whole hour presentation on just the benefits of exercise alone. But this is why so many professionals like myself feel that exercise may be the single best strategy for avoiding premature death. Pretty much right there with your diet. And you hear us talk about diet all the time, but that's not today's presentation. Now, if you really want to learn more, I implore you to get this book. It's a pretty fast read. I read it over a weekend, The 1 Minute Workout. And I know that sounds pretty wild, but it's true. You can get an effective workout in 1 minute. It's a little bit more, but the point is actual workout time. If it has to be that short, you can still benefit if you're doing it intense enough. And not just for you, but recommend this to your doctor. If your doctor has no clue about what high intensity interval training is and you want to work with that PCP because you've known them for 20 years, tell them to read this book. So what is HIIT? Well, HIIT stands for high intensity interval training. What is interval training? Interval training is simply alternating between higher intensity and lower intensity workouts. That's it. So there are many forms of interval training that you've seen, and you might have been maybe at an aerobics class or a workout class where you have a minute of higher intensity and a minute of lower intensity. And while that is considered technically interval training, it's not high intensity interval training. Now, high intensity interval training is going much harder workout portion followed by a longer rest. You'll need that longer rest because you're working out so much harder. Now, what people think this looks like, I always envision this sprinter sprinting across on a track. And, you know, while that is definitely a common form of HIIT training, it's actually not what HIIT training really is. Anybody can perform HIIT training because your high intensity workout round is relative to you and your health. And that could be walking really fast for somebody who's more advanced in age or very morbidly obese. It could be biking, it could be swimming. There's many, many forms. So what high intensity interval training really truthfully is 30 seconds on of I'm running for my life, I'm sprinting or biking or swimming for my life, followed by 4 minutes of rest. Now, that means if you are in that rest period and you're ready to go within 2 minutes, you didn't go hard enough in the 30 seconds. Now, what people think the benefits are is athletic performance. This is what I hear from my patients all the time. And while this is true, athletic performance is something that we will all gain from performing HIIT training. It's actually not the reason why you would do it at all. The actual benefits are, and drum roll please, because this is why you're here, all those amazing benefits we talked about earlier can be gained from HIIT training. So I want this to sink in. You can gain the same amazing benefits, those health-related benefits that we talked about earlier, from a fraction of the time working out. That's the reason why I'm stressing, folks, that there is no more time excuse for working out. Dr. Gabala's opinion, this isn't just my opinion, you don't have to believe me, but you can believe Dr. Gabala, that it's his strong opinion from all the research that he's compiled in that book, that you can gain these benefits in a fraction of the time. Why does it work? So our bodies are adapting machines. Hans Sal did a lot of work on this, probably I think it was about 80 to 100 years ago, and he came up with the general adaptation syndrome. The body's response to a stressor is to respond in a manner that is intended to reduce the stress the next time we experience that stressor, right? So if you were to sprint 40 yards, and the next time you sprint, whether you may notice it or not, your body will actually perform that sprint with less stress to its body. It adapts. And how would it adapt? Well, it'll improve the stroke volume, which is the amount of blood the heart pumps. It'll grow more blood vessels, specifically capillaries in the muscles, those small, tiny blood vessels to promote and deliver more oxygen to the muscles to fuel that workout. And then the actual larger blood vessels become more flexible, more malleable to better be able to deliver the increased need, the amount of blood. And really what's responsible for this, and this is still at the centerpiece of research right now, is all the different chemicals that are released from the body, from the muscles too, but a lot of the different organs in the system are releasing these different chemicals to improve our physiology, improve our body, and these are the reasons why we get these amazing benefits. Now, how do I get started? So you establish your current fitness level, right? So you could be that young, healthy athlete all the way to a morbidly obese, I haven't worked out in 20 years, or in the same category, I would say an 80-year-old who's not morbidly obese, but hasn't worked out in 20 years is probably in the same category as that 60 or 40-year-old morbidly obese person. So you need to figure out, and then somewhere in the middle of that spectrum would be, maybe the 20, 30, 40-year-old who hasn't worked out, or maybe that 40, 50-year-old that has worked out, maybe a little overweight, is the range that we're going to experience here. Okay, so you've figured out what health fitness level you're in. What's your current fitness level? Step 2 is figuring out which method is best for you. Now, people in the young fit category can do whatever they want. People in the morbidly obese or very old, advanced age is probably just going to be able to walk fast in the beginning. And everybody else in between. My go-to for most people is a stationary bike, because that allows you to stand up as you're pedaling, and you can crank that intensity really high. And swimming too as well, but that's a little bit more cumbersome. So the stationary bike is honestly my favorite method. You can get those at most gyms, and gyms are open now, folks, despite this pandemic. And honestly, if you're going to really commit to this, go purchase a used stationary bike. You can get some from a couple $100 to less than $1,000. Okay, good. Now you know what method you're going to go with. Then you need to understand, how do you rate the intensity of your workouts? Because in order to perform high intensity interval training, you need to understand what it means to be at the most intense level and everything in between, down to a very low intense level. We use this scale called RPE, the rating of perceived exertion. 1 would be barely walking, and 10 plus would be running for your life. Somebody is chasing, a tiger is chasing me, or someone's kidnapping my kid. That I use that as a joke, but that really is how intense you go, and that mental factor of imagining that will help you push even a little bit harder. The final step is start slow. Wherever you're at in the spectrum, this is that you can consult with your physician to help you decide what level to start with too as well. Now, this graph here shows you on the left the RPE, the intensity basically, and then on the bottom is time.
So you warm up at an intensity level of 1 or so for about 3 minutes. Then you get started with your first higher intensity round at that RPE of 3. You're going to do that for 3 minutes. Then you're going to lower the intensity down to somewhere between 1 and 2 for 3 minutes. And then you're going to repeat that pattern of 3 minutes on, 3 minutes off. And you're going to do that for up to about 30 minutes. Don't stress if you can't get all the rounds done your first time. If you're one of those patients that are getting started, that are very out of shape, what's important is to do as many rounds as you can, and your goal is to work up to 30 minutes for this workout.
And so that beginner stage, those very, obese or very advanced age patients out of shape should start here. So you notice you have your workout portion, and this could be walking faster, walking slower, walking faster, walking slower, maybe a light jog followed by a lower jog, whatever it takes to get what you think would be a perceived exertion of 3. Now, depending on where you're at, the starting point, you can progress to when you feel this overall becomes pretty easy. The intermediate workout, and you may start here too as well if you definitely were in that middle category of fitness levels.
Which is something that you are working as a progression towards. As the beginner workout becomes easier and easier, you start working towards intermediate. The intermediate workout, the time-wise, is the same pattern of 3 minutes on, 3 minutes off, 3 minutes on, higher intensity, 3 minutes off, resting. But this time you're working up to a pretty heavy intensity. We give this a rating of perceived exertion of 7. So this will, for most people, not be walking. You will have to do some sort of faster type motion, maybe a slower swim, maybe a lighter jog. Again, this is all going to be relative to you and your fitness level, but we really got to be huffing and puffing and They describe that level intensity 7 of difficult to keep a conversation going. That's how intense this is. But mind you, this is something that you are able to do for 3 minutes. And if you're able to do it for 3 minutes, it's not as intense as our advanced workout is going to be, which we're about to go over here next.
This is my favorite workout, and I do all sorts of different variations of this, but this is a 10 plus intensity right here for 30 seconds. And I can tell you, even at my fitness level, I am huffing and puffing and catching my breath for those 4 minutes that follow those 30 seconds. Now, again, you don't have to be an athlete. Even my obese, overweight, or out of shape elderly person, you will figure out once you work up to this fitness level, whatever activity gets you to a 10 plus, that's gonna be your workout. You can do that for 30 seconds and then you're gonna rest. And you literally do 5 rounds. So we're talking 2.5 minutes of exertion, folks. That is it. That is everybody's goal. And I'm very confident that most people will be able to make it here. We're here to help you in our programs. Just ask us questions when you come in to do your reviews, and our staff are going to be more than happy to take the time to help give you some ideas and answer the questions that you may have in regards to developing these workouts. Now, I'm gonna let this sink in. I want you guys to understand there is no more excuse for not having time to work out. On my busy days, if I have to read or if I'm working on the computer, I will work, albeit I'll work slow in those 4-minute rest periods because I'm huffing and puffing. But if I am that strapped for time, I will work during those 4 minutes. So there is no more excuses, because in those scenarios, if you're working during those 4 minutes or you have to do something, you have to maybe babysit or watch something, you can do it during those rest times. And really we're talking about 2.5 to 3 minutes of actual high intensity workout time. So much easier and better than that boring 45 minutes steady state cardio 3 times a week. You can still do that. And that serves a role for additional calorie burning if you want to really ramp up the weight loss. But I implore you to work up to this program first and add that later and next if you even need to, because this can help on its own for great weight loss, especially in combination with a good diet. So I want to end here, folks, with some key points and reminders. Work yourself into those higher levels. Try different workouts too, right? The swimming, the biking, the jumping, the burpees. You can do all sorts of different, you can literally turn any workout into a HIIT workout. That's why I love this. Find what you like, and then when you do find what you like, don't do it for more than a couple months, and then make sure you switch, because your body is always adapting and you want to continue to challenge it to benefit from these workouts. And I want to end on the note that, please, I'm imploring you to make this a lifestyle choice. Commit for the rest of your life to do this workout 3 times a week. I promise you, you won't regret it. All right, folks, that's Dr. Jones checking out, and I look forward to seeing you guys in the clinic.